Tubulointerstitial nephritis refers to a group of inflammatory diseases that light up the kidney, just like this fire here, about to envelope the structure of this eerily kidney-shaped Ferris wheel. The kidney interstitium and tubules can both be involved. That's where the tubulointerstitial part comes from. But unlike what we saw with ATN, tubulointerstitial nephritis usually spares the vasculature and glomeruli, at least in early disease. So again, we're going to focus on inflammation affecting the inner supportive structure of the Ferris wheel here. And when an inflammatory infiltrate rushes into the kidney interstitium acutely, we're going to call it acute interstitial nephritis, or AIN. An acute inflammatory response, like this, is most often induced by drug therapy. And in reality, virtually any drug can cause AIN. So we'll just sketch in some of the more common examples that you'll likely see on the test. I mentioned that it's Halloween, right? And in 1984, nothing was cooler than dressing up as a non-copyright infringing paranormal exterminator. Complete with that pretty creative, I might add, backpack ready to shoot some ghosts. An anti-inflammatory fire extinguisher, like this one, is our recurring sketchy symbol for NSAIDs. And while they're normally used for blocking inflammation, in this scene, NSAIDs are actually causing a hypersensitivity reaction and precipitating AIN. Yeah, he's only making things worse here. His friend is furious. He told him not to pull the lever that turns the power back on. All they had to do was complete the dare. They're in and they're out. Why does it have to be more complicated than that? A furious kid, like this one, in front of the loop-de-loop of Henley roller coaster, no less, is our recurring symbol for furosemide, a diuretic agent that works at the loop of Henley. In fact, numerous diuretics, including loop and thiazide diuretics, have been implicated in AIN. Many beta-lactam antibiotics, too, including penicillins and cephalosporins. So let's just incorporate a couple purple pencils into the structure of the Ferris wheel there. That's better. The purple pencil is our recurring symbol for penicillin, the prototypical beta-lactam. Now, part of the dare was that they had to add some kind of vandalism before leaving. So, they brought a few rotten eggs along. And at Sketchy, rotten, sulfur-ridden eggs like these are a recurring theme for sulfa drugs. This includes sulfonamide antibiotics and trimethoprim sulfamethoxazole. And let's face it, sulfa drugs like to be blamed for almost every kind of hypersensitivity syndrome you can think of. So why not throw AIN on the list?